Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering pharmacology. You have to know your meds, guys. If you haven't done so already, please be sure to like and subscribe below. Without any further ado, guys, let's get started. First question. The nurse is administering an IM injection to a client. When the nurse aspirates, there is a blood return. What is the most appropriate action for the nurse to take? 1. Continue to administer the medication. 2. Withdraw the needle and administer in another site. 3. Withdraw the needle, discard the medication, and start over. Or 4. Change the needle before administering the medication in another site. If you're new to my channel, guys, go ahead, just press the pause button. Take as long as you need to formulate an answer, and whenever you're ready, press the play button and we will resume. All right, guys. So the correct answer is 3. You want to withdraw the needle, discard the medication, and start over. Why? Well, in the question, it says that we're giving what kind of injection? IM, intramuscular. The fact that we saw in the question says there's blood return, that lets us know we're not in the muscle. We're where? In the vessel. Okay? We don't want to be in the vessel. We're not doing something within the vessel. We want to be in the muscle. So you're going to completely discard the needle, discard the medication, because now has the patient's blood in it, and you have to start over. So let's look at our wrong answer choices. 1, continue to administer the medication. When you choose that answer, you are letting your instructor, you're letting the test writer, you're letting NCLEX know that you have no idea what's going on. You don't even realize that you hit a vessel and you're supposed to be in the muscle. You don't realize something's wrong. And guys, just a hint, whenever you're doing questions and they give you a situation and they ask you, what are you going to do next? If something's wrong, you don't just continue doing whatever you were going to do. You don't just continue to monitor. You don't just continue to document. You just don't continue that action. You have to do something. You have to do something differently. And in this case, we know what the answer is, so it's not 1. Choice 2, withdraw the needle. Very good. You do want to withdraw the needle. But look what it says, and administer in another site. So you're going to use that same syringe that has blood in there with the medication? That medication that's tainted with the blood? Absolutely not. So that's wrong. Remember what I told you guys, if the whole answer is not correct, the whole answer is wrong and you need to get rid of it. Choice 4, change the needle before administering the medication in another site. So you're still going to give the medication with blood in it? Absolutely not. The answer is 3. Next question. The nurse is to administer a sub-Q injection. Which technique is correct? 1, pull the skin taut, insert a 21 gauge needle at a 90-degree angle. 2, pinch the skin, insert the 25 gauge needle at a 45 degree angle. 3, stretch the needle taut, insert a 27 gauge needle at a 10 degree angle. Or 4, pinch the skin, insert a 21 gauge needle at a 60 degree angle. And I'll give you a moment to think of your answer. And the correct answer, guys, is 2. You want to pinch the skin, insert a 25 gauge needle at a 45 degree angle. How do we know this? If you go back to the question, what kind of injection are we giving? Sub-Q. So what do we want? The fat. We're giving subcutaneous injection, so we want that patient's fat. So we're going to pinch the skin up. We want that fat. And 25 gauge, absolutely. And you're going to give it at a 45 degree angle. You're not going to give a 90 degree angle because we're not going for the muscle. We want to make sure we get that upper layer, that sub-Q fat. And that's why you're giving it at the 45 degree angle. Now let's look at our wrong answer choices. We have 1, pull the skin taut. That's tight. When you're pulling that skin tight, you're not going to be getting the fat. Okay, so that's the first thing that's wrong. And then it says insert a 21 gauge needle at a 90 degree angle. You see choice 1? That's when you're giving an intramuscular injection. When we want to get the muscle, that's when we're going to place that needle at 90 degrees and we're going to make sure that the skin is pulled taut. Taut means tightly, okay? Because we don't want that fat. Choice 3, it says to stretch the skin taut. Again, no. You do that when you're giving an IM injection, not a sub-Q. So that's already wrong. And then it says insert a 27 gauge needle at 10-degree angle. Nope, you do it at 10-degree angle. How are you going to get the muscle? The muscle is deep down, right? You got to do at a 90-degree angle if you wanted to give an IM injection. Choice 4 says to pinch the skin. Okay, I'm with it so far. But then it says insert a 21 gauge needle at a 60-degree angle. Guys, that doesn't even exist. Forget it. So your correct answer is you're going to pinch the skin because we want that sub-Q fat, and you're going to give at what? A 45-degree angle. All right, next question. The nurse is to administer an IM injection to a 6-month-old child. What is the most appropriate site to use? 1, vastus lateralis. 2, dorsal gluteal. 3, ventral gluteal. Or 4, iliac crest. And I'll give you guys a moment to think of your answer. All right, guys. So this is an infant because this is a child that's less than a year old. It's a 6-month-old that we're giving an intramuscular injection to. So the correct answer is going to be the vastus lateralis. Okay. Why? Let's look at our other choices. You have 2, dorsal gluteal. It's a 6-month-old infant. They don't have enough muscle yet in that area, and you don't want to hit that sciatic nerve. You'll give them sciatica for the rest of their lives. Wrong. 2, ventral gluteal. Again, they're only 6 months. They haven't developed muscle in that area. Wrong. And then choice 3, iliac crest. You're going to do that when you want a sub-Q injection, but for this patient, we want to give IM. So the perfect location is vastus lateralis, that upper thigh. That's where you're going to give the injection. An adult is receiving gentamicin IV every 8 hours. Which laboratory test does the nurse expect that the client will have done regularly? 1, CBC and hemoglobin. 2, BUN and serum creatinine. 3, SGOT and SGPT. Or 4, urine and blood cultures. Garage door open. Okay, guys, and the correct answer is your BUN and creatinine. Why? Gentamicin is known to be what? Nephrotoxic. It's very hard on the kidneys. So you're going to see serial lab markers drawn for the BUN and creatinine because you want to see how well the kidneys are doing with this medication being prescribed to the patient. Now, let's look at our other choices. You have the CBC and hemoglobin. We check the CBC and hemoglobin when we're checking for things like anemia, and gentamicin isn't known to cause that. You have your SGOT and your SGPT. That's actually, those are tests for the liver function studies. You'll be looking at AST and the ALTs. All of those tell you how the liver's doing, okay? And the last one, of course, your urine and blood cultures. That's if you suspect maybe the patient has an infection, you want to do a culture to see what kind of bacteria is growing, but that's not the case. When it comes to gentamicin, we know that it's nephrotoxic. It's very hard on the kidneys, so you have to be watching your BUN and your creatinines very closely. Which observation, if reported by a client, is most suggestive of an adverse reaction to gentamicin? 1, a WBC of 8,000. 2, ringing of the ears. 3, itching. Or 4, nasal stuffiness. And the correct answer is 2, ringing of the ears. Ringing of the ears, guys, is a sign or symptom of an adverse reaction of gentamicin. What kind of adverse reaction? Toxicity. The patient's getting toxic levels of this medication, and one of the signs and symptoms is that the patient will complain of ringing of the ears, okay? Choice A, a WBC of 8,000. There's nothing wrong with that. Normal WBCs is 5 to 10,000, so that's within range. And then choice Choice 3, itching, and choice 4, nasal stuffiness. Neither one of these are adverse effects of gentamicin. What we know is the adverse effects is toxicity, such as ringing of the ears. All right, next question. Penicillin V potassium, 500 milligrams by mouth 4 times a day is ordered for an adult client. He reports that he took penicillin for the first time 2 months ago. What should the nurse do? 1, be sure that skin testing for penicillin allergy has been done. 2, observe for signs of an allergic response. 3, withhold the penicillin. Or 4, notify the physician. And I'll give you a moment to think of your answer. And the correct answer, guys, is 2, observe for signs of an allergic response. Why? Penicillin is famous for patients being allergic to it or having a response. So those are one of the medications that you're going to be watching out for an allergic response. Let me tell you what the best answer would have been, but it wasn't one of the choices on here. But if you see it as a choice, that's what you need to choose. The one that says, ask them what was their response. When a patient says, oh, I had penicillin two months ago, or I've had penicillin in the past, because penicillin is one of those antibiotics that are known when patients are allergic to it, the allergic response is severe. We always ask, oh, well, what was your reaction? How did your body react to it? If the patient goes, oh, I started itching all over, I got welts all over my body, I broke out in hives, I felt like my throat was closing up, oh, I got rushed to the ER, that means that patient had a true IgE-mediated response. Are we going to give that penicillin? No. We're going to hold that medication and call the doctor. Hey, I don't know if you know this. I saw you ordered the penicillin, but the last time that patient had the penicillin, they were in the ICU for 3 days, right? So you always want to ask the patient what was their response. That wasn't a choice here. So the next best thing is observe them for signs and symptoms of an allergic reaction. And guys, there's a forciform reaction, which that one is sometimes the patient will take penicillin and they get like a nickel-sized rash on their left arm or maybe on their tummy, and that was it. That's not a true IgE-mediated response, okay? A true IgE-mediated response, like I said, the patient breaks out in hives. They're itching all over. They can't breathe. They feel like their throat is closing up, all right? That is a true allergic response. All right, next question. The nurse in the physician's office is instructing an adult about taking penicillin V potassium 4 times a day. When should the nurse tell him to take the medicine? 1, with meals and at bedtime. 2, once a day at 10 a.m. 3, on an empty stomach at 6-hour intervals. Or 4, with orange juice at 4-hour intervals. And I'll give you a moment to think of your answer. And guys, the correct answer, on an empty stomach, which it does need to be taken on an empty stomach at 6-hour intervals. They gave us a clue in the question, guys. In the question, it says 4 times a day. So if you're taking it at 6-hour intervals, 6 times 4 gives you 24. That's your 24 hours. So even if you didn't know the answer, you still should have came up with the correct answer, guys. Excuse me. All the other answers are incorrect. It's 3 on an empty stomach, 6-hour intervals. That means every 6 hours, patient would be taking it 4 times a day. So that's very important for you to know about this medication, and you want to take it on an empty stomach. We don't want this type of medication fighting with receptor sites in the stomach, okay? We want the stomach empty. All right. A 10-month-old child has been diagnosed as having acute otitis media. The pediatrician prescribed amoxicillin suspension. What instructions should the nurse give the child's mother? 1, when your child's temperature has been normal for 2 days, discontinue the medication. 2, discard any unused medication. 3, if your child has symptoms of an ear infection, again, start giving her the leftover medication. Or 4, give your child all the medication in the bottle. And the correct answer is 4. Give your child all the medication in the bottle. This is the same teaching you give an adult. You know how you've always learned when a patient's taking an antibiotic, you teach them to take the whole amount prescribed? Same thing for the child. You know, don't leave some over once you see the child's feeling better. You're like, oh, well, let me keep this just in case they get sick next time. You have to teach the parent that if you do not give the whole amount of medication, this infection can come back, and it can come back worse. So you teach the parent to give the whole amount of prescribed medication. The answer choice is 4. Choice 1, where it says, after a patient's been normal, discontinue the medication. Absolutely not. They need to take the whole prescribed dose. Choice 2, discard any unused medication. Excuse me, there should not be any unused medication. Why? Because the patient's taking the whole thing. We told them that. Choice 3, if your child has any symptoms of an ear infection, again, start giving the leftover medication. There should not be any leftover medication. And then you have the correct answer, choice 4. Moving on. K-Flex 250 milligrams every 6 hours is ordered for an adult. The nurse notes that the client's history indicates that she has an allergy to penicillin. What is the most appropriate initial action for the nurse? 1, notify the doctor. 2, observe the client carefully after giving this medication. 3, administer the K-Flex IV instead of by mouth. Or 4, ask the client to describe the reaction that she had to penicillin. All right, I kind of gave you guys this answer, so you guys all know what the answer is. It's 4. You're going to ask the client to describe the reaction that they had to penicillin. Why? We want to know if the patient has a true IgE-mediated response. Do they have a true allergy to the penicillin? So if that patient says, oh, you know, last time I had penicillin, I had a headache. That's not a true allergy. Oh, last time I took the medication, I was kind of sleepy and, you know, I slept for an hour or 2 more than normal. No, that's not a true allergy. But if that patient says, oh my gosh, I broke out in hives, I was itching all over, I felt like my throat was closing up, I couldn't breathe, they had to give me an EpiPen, my neighbor had to give me an EpiPen while they were waiting for the ambulance to show up. Okay, that is a true IgE-mediated response. That is a true allergic response that the patient has, okay? By the way, K-Flex, what was I going to say to you about this? Oh, yes. K-Flex, this, guys, is a cephalosporin, and if you've taken chemistry already, so that you know this, but on that chain, there's a certain portion of that chain for cephalosporin that they share that same chain, I should say. I don't know. They share the same thing as penicillin. So that's why many patients who are allergic to penicillin are also allergic to the cephalosporin because of and it's just one tiny little portion of that whole long chain. But if they're allergic to that one tiny portion, they're going to be allergic to both. And so we don't want to take any chances. So that's why we always find out, okay, what was the response? And if we find out the patient had a true mediated response, we don't know what part of the chain that the patient's allergic to. So guess what? There's so many other drugs on the market. We can give the patient another type of antibiotic. They don't have to get the cephalosporin if they're allergic to penicillin. There's so many other medications out there. So you're going to withhold the medication and call the doctor, and the doctor will prescribe something else. Okay. All right. Which of the following persons would be least likely to receive tetracycline? 1, an adolescent with acne. 2, a woman with chlamydia who's 7 months pregnant. 3, a 10-year-old child with Rocky Mountain spotted fever. Or 4, a 32-year-old man with walking pneumonia. Okay, guys, and the correct answer is 2, the woman with chlamydia who is 7 months pregnant. The problem with this woman getting the tetracycline, it's not a problem that she's a woman, and it's not a problem that she has chlamydia. The problem is that she's pregnant, okay? Tetracycline is teratogenic, all right? Your baby mess around and come out with 3 eyeballs, right? Or missing a limb, and something else that tetracycline can cause, and we don't give it to pregnant women, what's it called? Grade 2 syndrome. Okay, and in the question, it says, let me go back and take a look. She's 7 months pregnant. This is around 7 months. That's where, you know, the gums are developing. So we don't take that chance. If the woman, and matter of fact, let me tell you something, how dangerous tetracycline is to a woman that is pregnant. Anytime tetracycline is ordered for a female of childbearing age, an HCG test should be done. We should make sure that that patient is not pregnant because, like I said, it's teratogenic and it will harm the developing fetus, okay? Now, for the other choices, acne, Rocky Mountain fever, and walking pneumonia, tetracycline is actually a good choice and it's very effective. Right? With the walking pneumonia, most likely it's going to be mycoplasma. So that tetracycline is, a great antibiotic that we would give for that, along with the Rocky Mountain and acne. And don't forget, another famous question that they love to ask about tetracycline acne. They love to give a situation that you have a teenager, she's on the track team, and, she comes in because of her face, and it's very, very severe acne. We don't give tetracycline for, regular teenage acne. No, we give tetracycline for severe acne. Like, patients tried everything else, it doesn't work, right? So, patient comes in, it's a teenager, she's on the track team. What are you going to do? Do you just give the tetracycline as ordered? No, you're going to look for HCG and make sure that she's not pregnant. Why? She's a female and she's of childbearing age. And if she's pregnant, she cannot get tetracycline. Number one. Number two, they told you that she's a track runner for a purpose. She's on the track team. She's outside running, outside in the sun, okay? Tetracycline tends to have photosensitive properties, okay? And it can give the patient a rash just from being out in the sun. So those are two very important things for you to know. How am I already almost out of time? I don't know, and I have so much more information to cover with you. I guess I'll have to do a part 2. All right, guys, next question. An adult client is seen in the clinic and, I can't pronounce, sulfasalazole Gastrin is prescribed. Which information is most appropriate for the nurse to include in this teaching? 1, limit your fluid intake to 4 glasses a day. 2, if it upsets your stomach, try taking it with an antacid. 3, avoid going out in the sun while taking this drug. Or 4, take the tablets with orange juice or milk. And the correct answer, guys, is 3, avoid going out in the sun while taking this drug. It causes photosensitivity. It's known for causing photosensitivity. What kind of drug is this? The sulfasalazole. Look at what it starts with. SULF. It's a sulfa drug, right? If it's a sulfa drug, it is known for causing photosensitivity. So you teach that patient, if you have to go out in the sun, cover up your skin. Wear a large brim hat. Wear a long sleeve shirts. Wear sunglasses. You want that patient to cover up their skin to avoid that rash that they're likely to get from being out in the sun. Okay. Now let's look at our wrong answer choices. 1, limit your fluid intake to 4 glasses a day. No, with this med, we want the patient drinking lots of fluid. I'm talking about 3 to 4 liters per day. We want them to drink. We want them flushing out their system. So number 1's wrong. Choice 2, if it upset. I literally can't even, if you chose this as an answer. You never give a medication with an antacid. Never. You want to know why? The antacid, what's the word I'm looking for? Neutralizes the medication, makes the medication ineffective. We don't ever give medication with, matter of fact, if a patient takes an antacid, you got to wait a good 2 hours before you give the patient the medication. Before or after. We do not want these two interacting because the antacid will cause that medication to be ineffective. So that's wrong. And then choice 4, take the tablets with orange juice or milk. No, we want you to take the tablets with a full glass of water. How much water did I tell you that patient needs to be drinking? 3 to 4 liters a day. So no, don't take it with juice. We want you to take it with water. We want you flushing your system and your kidneys. So the correct answer is 3. Next question. An adult client has pulmonary tuberculosis. He's receiving INH 300 milligrams by mouth, ethambutol 1 gram by mouth daily, and streptomycin 1 gram IM 3 times a week. When he comes in for a checkup, he tells the nurse that he hates getting shots and his ears ring most of the time. What is the best interpretation for the nurse to make regarding the client's complaints? 1. He may be receiving too much ethambutol. 2. He should be evaluated for adverse reaction to streptomycin. 3. Tuberculosis may have spread to the brain. Or 4. He's experiencing a reaction commonly seen when INH and streptomycin are given at the same time. Okay, guys, and the correct answer is 2. He should be evaluated for adverse reaction to streptomycin. What is this adverse reaction? Toxicity. What is that sign of toxicity? Tinnitus, ringing of the ears. That's what that patient's experiencing. Now let's look at our wrong answer choices. We have 1, he may be receiving too much. And see, I was with them at first when I saw too much, but I thought they were going to say streptomycin. But it says ethambutol. No. If the patient had too much of that ethambutol, what the patient would complain of was color blindness. Okay, that's that sign and symptom of toxicity. All right, not tinnitus, which is the ringing of the ears. And choice 3 and 4 are absolutely, they're just wrong. That it may have spread to the brain or this is common reaction. Absolutely wrong. The correct answer is choice 2, where the patient has the ringing of the ears. That sign and symptom that I can't think today, guys. I'm sorry. The tinnitus, the ringing of the ear, that's the sign and symptom of the streptomycin toxicity, okay? An adult client's being treated for genital herpes with acyclovir tablets. Which statement she makes indicates that she understands the therapy? 1, it is safe now to have sexual relations. 2, I will stay home from work until the blisters are gone. 3, the medicine will cure the herpes infection. 4, if the blisters come back, I will start taking the pills immediately. And the correct answer is 4, if the blisters come back, I will start taking the pills immediately. Guys, herpes is a viral infection. There's no cure. It doesn't go away. Now, what happens, it can go dormant where the patient they won't be symptomatic. They won't have the bumps down there. And then they'll have a breakout. And so you have to teach that patient that the minute that there's any sign and symptom of infection, they need to take those tablets. Okay, there is no cure. This is a viral infection. So let's look at the other answer choices. 1, it's safe not to have sexual relations. No, it's not. As long as that patient's symptomatic, they should not be having sexual relations at all. So that's wrong. Choice 2, I'll stay home from work until the blisters are gone. That's not necessary. Choice 3, this medicine will cure the herpes infection. No, it won't. This is viral, so it'll help control it. It'll help this medication. It decreases the severity and it decreases the length of that patient being symptomatic, but it doesn't cure the patient. This is a viral infection. The patient's going to have it until they die, unless a cure is invented, which it has not been invented yet. So they're going to have it till they die. So the correct answer is 4, if the blisters come back, I will start taking the pills immediately. As soon as they become symptomatic, they need to start taking those pills and no sexual contact. The clinic nurse is teaching an adult male who has AIDS. He's receiving zidovudine. Which statement he makes indicates that he understands the medication regimen? 1, if I get a sore throat and it is hard to swallow my capsules, I can empty the capsules into applesauce. 2, I'm hopeful that this drug will get rid of this awful disease. 3, I understand that I might need a transfusion. 4, I should take acetaminophen, Tylenol, not aspirin if I get a fever. And the correct answer is 3, I understand I might need a transfusion. Guys, this drug severely depletes the number of red blood cells. All right. Now, the red blood cells are important. We need red blood cells because that's what carries our hemoglobin. We need hemoglobin because that's what carries our oxygen. We need oxygen because that's what actually perfuses all of our tissues and vital organs, right? So our RBCs are very important. However, this medication severely depletes it. So when patients on this medication, they usually need several transfusions. So that is the correct answer. Now let's look at the wrong choices. You have one, if I get a sore throat, it's hard to... Excuse me. Do we ever open up capsules? Ever? Absolutely not. There's a difference between capsules and tablets. Okay? Tablet, if it's scored, you can break in half. Capsules, no. Okay? The reason certain medications are in capsules is because the capsule is supposed to dissolve X amount of time after it's been swallowed. So depending on what type of medication it is, maybe it's supposed to dissolve in the stomach, maybe it's supposed to dissolve in the small intestine. So you don't open it up. Absolutely not. We never open capsules. So that's wrong. Choice 2, I'm hoping this drug will get rid of this awful disease. There is no cure for HIV. It's a virus. There are treatment, but there are no cure. So that's wrong. And choice 4, I should take Tylenol, not aspirin if I get fever. Absolutely not. You should not be taking any over-the-counter medication. If you get a fever, you need to call your physician. So the correct answer is 3. Oh my gosh, I'm out of time. Okay, guys, this is our last question. I promise I'm going to be making a part 2 of this video for you. So just watch out for it. It's coming soon. An adult client's been diagnosed as having a rheumatoid arthritis and is started on piroxicam, 20 milligrams daily. 2 days later, the client calls a nurse and says that her joints still hurt. What is the best response for the nurse to make? 1, it may take up to 2 weeks before results are seen with Feldene. 2, take aspirin with the Feldene. It has an additive effect. 3, come in to see the physician. You should have pain relief by now. Or choice 4, you may need more medication. Take 1 additional pill each day. All right, guys, and the correct answer is 1. It may take up to 2 weeks before results are seen with Feldene. What is Feldene? It's an NSAID, non-steroidal anti-inflammatory drug. And so you're going to teach the patient it may take up to 2 weeks before you reach therapeutic levels in your body and you actually start to feel relief. So you have to teach that to the patient. All the other choices are wrong. So guys, I hope you found this video helpful. I have lots more meds and concepts to cover with you. So watch out for my next video. Please, guys, help support this channel. Please do not forget, of course, to like and subscribe below, but please share my content on your social media, or if you know anyone in the nursing program or studying for NCLEX, please share my material. Thank you so much for joining me, and I'll see you on the next video.